Hello student. Today we are continuing this next lecture on this fertility and infertility. Basically, last lecture we have seen the artificial methods, then contraception and the birth control. Okay, so now it is the important topic is there, the male and female infertility. Sometimes the couples are unable to have a children. The infertility is the failure to conceive even after 1 year of regular unprotected sexual cohabitation intercourse, and the infertility affects approximately 10 to 15% of couples of reproductive age. Its occurrence increases with age, and the main causes of infertility include the male factor infertility, ovarian dysfunction, tubal disease, endometriosis, then the uterine or cervical factors, and other causes may be physical, genetics, sexual transmission, drugs, immunological, or even psychological. So there is a different phenomena which are responsible for their infertility. However, in certain cases where infertility cannot be corrected, they can adopt a child or opt for special techniques of assisted reproductive to have a child. In vitro fertilization followed by embryo transfer is one such technique, and the resultant child is popularly known as the test tube baby. So the female infertility or male fertility, we aware in their couples, educate our infertility causes and prevention, conduct appropriate diagnostic workup, offer information on treatment options, provide resources for counseling and emotional supports. And these causes and treatment for male fertility is the azoospermia, inject the follicle stimulating hormones and luteinizing hormones, surgical fertilization, reverse vasectomy, unpaid sperm mobility repair, varicocele. So the vasectomy and tubectomy is important in the sterilization. Vasectomy means the procedure, sterilization procedure in the male is called vasectomy, and in the female vasectomy, tubectomy, in vasectomy, a small part of vas deferens is removed or tied up through a small incision on the scrotum, whereas in tubectomy, a small part of the fallopian tube is removed or tied up and through a small incision in the abdomen or through vagina. So in case of this happens in the particular male and female infertility. So the main causes of female infertility is the ovulation disorders, tubal abnormalities, endometriosis. Then the treatments for female infertility is the ovulation disorders, maintain normal body weight, clomiphene, metformin, gonadotropin therapies, laparoscopic ovarian drilling. Then the treatments for female infertility is, that is tubal abnormalities, in vitro fertilization with or without salpingectomy, the tuboplasty, tubal release irrigation reverse. Then the treatment of female infertility is the endometriosis, that is this endometriosis is important for their the in vitro fertilizations. ओव्युलेशन इंड्युसिंग ड्रग्स म्हणजे जे वेगवेगळे जे इन्फर्टिलिटी आहे की मेल फिमेल्समध्ये वेगवेगळे भाग आहे. फिमेलमध्ये काही टॅबलेट्स वगैरे घेतात, त्यांचे जेनेटिकल प्रॉब्लेम असतात, फिजिकली प्रॉब्लेम, सायकोलॉजिकल, आणि मेलमध्ये काय असते की काही त्यांची हॅबिटेट ॲडिक्शन असते, म्हणजे अल्कोहोलिझम किंवा त्यांचा एज फॅक्टर्स, याच्यामुळे हा प्रॉब्लेम येण्याची शक्यता असते. सो दॅट दिस ओव्युलेशन इंड्युसिंग ड्रग्स, the bromocriptine is prolactin hormone, dosage 2.5 mg 1 to 3 times per day. Some side effects may not be appropriate for patients with pituitary tumors greater than 1 centimeter. The ovulation inducing drugs, human menopausal gonadotropins, follicle stimulating hormones, they stimulate ovary to develop follicles 75 to 150 intrauterine per day, and 20 to 40 possibility of multiple births may not be appropriate in case of pituitary tumor ovarian cysts. The ovulation inducing drugs, that is gonadotropin releasing hormones, triggers normal pituitary hormones activities, so ovulation can occur. Effective women with hypothalamic amenorrhea, no known physical side effects. Ovulation pump administers injections every 90 minutes. User must carry pump with attached the IV tubing for 1 to 2 weeks. The treatment with surgery is pregnancy rates after surgery 45 to 75%, less than 60%, 35 to 48% in the stage 4. So in the endometriosis drug therapy, the endometrio means a condition resulting from the appearance of endometrial tissue outside the uterus and causing the pelvic pain, especially associated with the menstruations. So when this endometriosis happens, this endometriosis happen, bits of the uterine lining, that is endometrium, or similar endometrial like tissue grow outside of the uterus on other pelvic organs outside the uterus, and the tissue thickens and bleeds just as typical endometrial tissue does during the menstrual cycle. So there is a the failure of this ovulate. This failure of the ovulates is the female infertility in approximately 30% of the cases is due to a failure to ovulate, and in 2/3 of such cases the cause is not hormonal. Second is the production of infertile eggs, or the treatments for infertility is in vitro fertilization with embryo transfer, the gamete, zygote, cryopreservation, intracytoplasmic, etc. Damage to the oviducts. The tubal disease that causes damage to the oviduct results in female infertility in approximately 30% or 30% cases. Salping, it is the inflammation of the fallopian tubes due to infection by bacteria that cause gonorrhea and chlamydia, damage the oviducts and may lead to infertility if left untreated. The gamete fallopian transfer is oocytes. The zygote intrafallopian transfer, cyst. The cryopreservation is sperm or embryos are preserved by freezing the replacement of subsequent cycles. Then ICSI, intracytoplasmic sphere injection. ART, that is same-sex couples, combination of their own donor sperm and eggs through IVF, surrogacy and parent biological children. म्हणजे हे जे इन्फर्टिलिटी आहे याला वेगवेगळे कारण आहे. युटेरस कधी डॅमेज झालेला असेल इन फिमेल्समध्ये, किंवा डॅमेज सर्विक्स असू शकते, असे वेगवेगळे फिमेल्समधले प्रॉब्लेम आहे. आणि ते जर तुम्ही जर मेलमध्ये बघितलं तर मेलमध्ये वेगळे आहे. त्याच्यामध्ये टेस्टिक्युलर फेल्युअर असू शकते, त्याच्यानंतर प्रोस्टेट ग्लँडचा प्रॉब्लेम, हायपोगोनेडिझम म्हणजे काय की इट प्रोड्यूस दी इनफ टेस्टोस्टेरोन टू सफिशियंट स्पर्म ऑर द बोथ. दिन cryptorchidisms, male baby may be born undescended testes. And the congenital abnormalities म्हणजे the infertility may result from problems present at birth such as a deformed testis or tubal defects such as the congenital absence of vas deferens which is associated with cystic fibrosis. The genetic causes such as the Klinefelter syndrome, mutation in genes for cyclic fibrosis, the microdeletions in the Y chromosomes and mutations in the androgen receptor which produce androgen. The insensitivity syndrome may also be responsible for the male infertility. तर अशा प्रकारचे प्रॉब्लेम तिथे असण्याची शक्यता असते. स्पर्म absence असते. The absence of sperm in the semen is called the azoospermia. About 5% of male infertility occurs as a result of complete lack of sperm production. त्यानंतर लो स्पर्म काउंट, abnormal sperm morphology, reduced sperm motility, autoimmunity. About 5 to 10% of male infertility is probably due to an adverse immune response by the male to his own sperm, and the autoantibodies are produced which attack the sperm and hereby effectively lower count of the variable sperms. अशा वेगवेगळ्या प्रकारचे त्याच्यामध्ये इन्फर्टिलिटीचे कॉजेस आहे आणि त्याच्यावर वेगवेगळे ट्रीटमेंटसुद्धा आहे. ते ट्रीटमेंटसुद्धा आपल्याला करणे आवश्यक आहे. ते ट्रीटमेंट जर बघितलं आपण तर बरेचसे ट्रीटमेंट आहे. तर ते ट्रीटमेंटला आपण नेक्स्ट लेक्चरला ते आपण बघूया.